collaboration is what will get us further than doing stuff by ourselves. And I think we're not able to reach all the people that we want to reach by ourselves. So it's looking for meaningful partnerships and collaborating and getting our messages across. I think that's the most important things.
Interdisciplinary collaboration allows us to collect more multidimensional evidence about how something works, mechanistically in biological terms, but also in social terms. So in implementation and in evaluation, how does it work at all stages of a rollout?
And if we remember that collaboration is both a process and an outcome, that collaboration doesn't just inform recommendations, but it helps us to ensure they are relevant, and also, if we do it well, it gives our recommendations legitimacy and credibility because we've been involving a diverse range of people.
By building a more multidisciplinary evidence base, we build that nuance. We build that sense of how something works in all of its meanings of working or not working. And I think that's really valuable.
To ensure that knowledge is co-produced in a two-way street means that you understand that the people whom you're trying to communicate your knowledge with also have research evidence. It may be their indigenous ways of doing things, it may be their lived experiences, but all those need to count, which means that, as I said in the beginning, you need to come with a humble heart, willing to listen with humility to their perspectives, to their stories, to their shared experiences.
So if we start by recognizing others as holders of knowledge and seeing their strengths, I think that's key to shared learning and shared problem solving. So if you're not hearing local voices and learning from local knowledge, then I suggest you're not really collaborating globally.
We need to bring in the global knowledge to the local level. But we can do that only when the local community accepts it. So acceptance can be there only when we co-create the knowledge along with them.
You're not just superimposing the knowledge that you have, but you guys are kind of collaborating, giving them the opportunity to ask questions and also respond to some questions. For example, where did you hear this? Why do you believe this source of evidence, and things like that?
For so long, it's been researchers, clinicians, leaders from the global north really setting the priorities, setting the standards, setting the questions that we're going to answer, even when those questions are being answered in the global south or in resource limited settings or by marginalized populations. And so we want those diverse perspectives and we want global collaborations. But I think that doing this well starts with creating equitable global collaborations where leaders and clinicians and researchers from the global south are not just seen as implementing partners, but are seen as true equal partners from the first stages when we conceptualize the questions that are important to ask, when we design the projects, when we think about who the populations are that we're going to seek their perspectives or seek their data in some way.
I work with the Still-Based CRE and the two wonderful researchers, Christine Andrews and Kirsten Tyndall, and Kirsten herself is also a bereaved mum, and we kind of came together because we realised that we wanted to involve more bereaved parents within research, but there was this gap of translation of what research is. And so we kind of worked out, well, why don't we develop a resource just explaining briefly what research is? And then that led to actually that being co-produced with several bereaved parents, including myself and Kirsten and Christine leading the way, where she was able to facilitate. And that's where, she shows herself as an exemplary ally in this area, because she was able to help facilitate getting grants for us to be able to do this work.
Seek people who are valuable partners and who can help you reach those people. It could also be someone who can help you with the graphic side or with the dissemination side if you're not very comfortable with it yourself. But there are people out there who are willing to help and who are able to help you to reach your goals on that, I think.